If you are on Medicare in 2026, there is a hidden cost most seniors are paying without knowing it, and it is draining an average of $4,300 a year from their retirement income. The shocking part is, almost all of it is preventable. The information you are about to hear is not in the Medicare and You handbook. It is not in the glossy brochures from insurance companies. And the people who could explain it to you almost never do, because they make more money when you stay in the wrong plan. Stay with me for the next 12 minutes and I will show you the 5 hidden Medicare costs eating your retirement check. The one prescription trick that can slash your drug costs starting tomorrow. The IRMAA appeal form most seniors have never heard of that can save you thousands of dollars. The open enrollment mistake that costs the average senior over $1,000 a year. And the free phone number every senior should be calling once a year that almost nobody uses. Here is the truth about Medicare in 2026. The standard Medicare Part B premium this year is $185 a month, deducted directly from your Social Security check before the money ever reaches your bank account. That part is straightforward. But on top of that premium, there are 5 hidden costs most seniors never see coming. And once you understand them, you can start eliminating them one at a time. The first hidden cost is the IRMAA surcharge. IRMAA stands for Income-Related Monthly Adjustment Amount. If your income from 2 years ago was above $106,000 for a single filer, or $212,000 for a married couple, you pay an extra surcharge on top of your Medicare premium. At the top of the bracket, that surcharge can add over $400 a month to your Medicare bill. That is almost $5,000 a year extra, and it is based on your income from 2 years ago, which means a one-time event in 2024. Selling a home, taking a lump sum from a retirement account, receiving an inheritance, can spike your 2026 premium even if your current income is much lower today. The second hidden cost is the Part D late enrollment penalty. If you went more than 63 days without prescription drug coverage when you were first eligible for Medicare, you pay a penalty for the rest of your life. The penalty is 1% of the national base premium for every month you went without coverage. A senior who delayed 5 years is paying 60% more on their drug premium forever. It does not go away. It is permanent. The third hidden cost is the Part B late enrollment penalty. Same logic, different program. If you did not sign up for Part B when you were first eligible, your premium goes up 10% for every full year you went without it. So if you delayed 3 years, your Part B premium is 30% higher than the standard for the rest of your life. This catches a lot of seniors who retired early, lived off savings, and figured they would deal with Medicare later. The fourth hidden cost is the prescription drug overpayment trap. Almost every senior is paying too much for prescriptions, sometimes by hundreds of dollars a month, because they are in the wrong Part D plan, the wrong Medicare Advantage plan, or filling at the wrong pharmacy. Drug plans change every year. Your preferred pharmacy may no longer be a network. A drug that was Tier 2 last year may be Tier 4 this year. Most seniors stay in the same plan year after year out of habit. The average senior who reviews their plan and switches when something better is available saves between $400 and $1,200 a year on prescriptions alone. The fifth hidden cost is being in the wrong Medicare Advantage plan entirely. These plans change their provider networks, their drug formularies, and their out-of-pocket costs every single year. The plan that fit perfectly in 2024 may have dropped your doctor in 2025 and raised your copays in 2026. Staying in a Medicare Advantage plan that no longer fits your needs costs the average senior between $600 and $1,800 a year, and sometimes more. Now, the one prescription trick that can slash your drug costs starting tomorrow. Go to medicare.gov, click on Find Health and Drug Plans. Enter every single prescription you take, and let the tool show you which Part D and Medicare Advantage plans cost you the least based on your exact medications and your local pharmacies. This tool is free. It takes about 15 minutes to use. The average senior who runs this comparison every year during open enrollment and switches when a better option exists saves between $400 and $1,200 annually. Some save thousands. But here's the more powerful version of that trick. For some prescriptions, paying cash with a GoodRx coupon is actually cheaper than running the prescription through your Medicare Part D plan. This is especially true for many generic drugs. The way to know is to always ask your pharmacist a simple question. What would this cost if I paid cash with a coupon? Compare that number to your Medicare copay. If the cash price is lower, pay cash. You can do this on a single prescription at a time. Some seniors save hundreds of dollars a year just by asking this one question every time they refill. Now, the IRMAA appeal form most seniors have never heard of. If you are paying an IRMAA surcharge because of a one-time income spike, you may be able to appeal it and get the surcharge reduced or eliminated. The qualifying events include retirement, the death of a spouse, divorce, the loss of a pension, the loss of income-producing property due to disaster, or the receipt of a settlement from a former employer. If any of those apply to you and your current income is significantly lower than the income on the tax return Medicare is using to calculate your surcharge, you can file Form SSA 44 with your local Social Security office. The form is 2 pages. If approved, your surcharge is reduced or eliminated, sometimes retroactively. This single form has saved seniors thousands of dollars per year, and most people have never heard of it. The open enrollment mistake that costs the average senior over $1,000 a year is simply not using open enrollment at all. Medicare open enrollment runs from October 15th to December 7th every year. During this window, you can switch Part D plans, switch Medicare Advantage plans, or switch back to original Medicare with a Medigap supplement. After December 7th, your choices are locked in for the entire next year. Most seniors do not change anything during open enrollment, partly because the system is confusing, partly because reviewing plans feels like work, partly because the insurance companies count on you not switching. The reality is that 15 minutes once a year, every year, can save you hundreds or thousands of dollars. Now, the free phone number every senior should be using once a year that almost nobody calls. It is your state health insurance assistance program, called SHIP. Every state has one. They provide completely free, unbiased Medicare counseling to seniors. The counselors do not sell anything. They do not get paid more for steering you into one plan over another. They will sit down with you, look at your prescriptions, your doctors, your situation, and tell you honestly whether you are in the right Medicare option for your specific needs. To find your local SHIP office, go to shiphelp.org or call 1-877-839-2675. Book an appointment for the fall during open enrollment. Put it on your calendar today before you forget. 3 steps to take this week. Step 1. Log into ssa.gov and look at what is actually being deducted from your Social Security check for Medicare. Compare that number to the standard Part B premium of $185. If you are paying significantly more, you are paying IRMAA. Check whether you qualify to appeal it using Form SSA 44. Step 2. Make a complete list of every prescription you take, the dosage, the frequency, and the pharmacy where you fill it. Make a list of every doctor you see regularly. Have this list ready for when open enrollment opens in October. This 15 minutes of preparation is the difference between making a smart switch and staying stuck in a bad plan another year. Step 3. Call your SHIP office at 1-877-839-2675 or visit shiphelp.org and book a free counseling appointment for October or November. This single appointment, once a year, every year, can save you hundreds of dollars and protect you from changes in your plan that you would otherwise miss. Medicare is one of the most important promises this country has ever kept to its older citizens. For most seniors, most of the time, it works. But the system has grown enormously complicated. The premium structures are layered. The penalties are permanent. The surcharges depend on income from years ago, and the people who profit from your confusion are not going to clear it up for you. The seniors who pay the lowest Medicare costs in any given year are not the wealthiest seniors. They are the seniors who know about the IRMAA appeal, the Plan Finder tool, the cash versus coupon question, and the free ship counseling. Now you do too. If this video helped you, share it with another senior or with the adult child of a parent on Medicare. The information in this video could easily be worth $1,000 or more a year to someone who applies it. Hit subscribe for more videos that explain the rules nobody else does in plain English. Take care of yourself, take care of your money, and I will see you in the next one.